Hi, this is our value proposition for a new approach to endometriosis treatment, and our title is Rings of Relief. My name is Abigail Rivers.
I'm Emma. And I'm Lily.
And Leah can't be here at the moment.
First, let's discuss the unmet needs in endometriosis management. What is endometriosis? It is a chronic gynecological condition where endometrial tissue grows outside of the uterine cavity. This misplaced tissue is prone to inflammation and can cause symptoms such as pain, irregular periods, fatigue, as well as infertility. What is the problem? Currently, there is not an adequate solution for endometriosis prevention or symptom management. We'll discuss that more later on. Who can have this condition? Endometriosis affects around 1 in 10 women of reproductive age worldwide. And why is a solution needed? The physical symptoms of this condition, as well as the downstream impacts such as psychological conditions and a decreased quality of life, are severe and need to be addressed.
Moving into our proposed solution. Our proposed solution is a polyurethane drug-eluting ring. We chose polyurethane to be the material of this ring because it's a class of polymer. It has high biocompatibility, low cytotoxicity, high flexibility, and high low capacity and tension and compression. And we are planning to put a drug called danazol into this ring. The danazol is a synthetic steroid similar to testosterone, and it inhibits steroidogenesis in the ovaries, which minimizes endometrial tissue growth, hopefully leading to reduced pain symptoms. And specifically, we wanted to use a ring because rings do exist currently on the market for vaginal insertion, just in the form of birth control and hormone releasing. So this is our proposed change. And this vaginally inserted ring, the host is able to insert them themselves without a need for a procedure at the doctor's. And this ring is going to remain in the body for 3 weeks with 2 grams of danazol in it, with about 95 milligrams dispersed into the body daily. And the danazol is going to be diffused from the ring into the vaginal mucosa in order to enter the body. And then the host removes and replaces the ring on their own.
Standard treatments for endometriosis include combined hormonal contraceptives and laparoscopic surgery to remove lesions. Despite these options, many patients experience limited relief. 11 to 19% report no reduction in pain symptoms during treatment, and 5 to 59% still have residual pain after their treatment ends. These statistics underscore the urgent need for more effective therapeutic solutions. The NuvaRing, a hormonal contraceptive vaginal ring on the market, costs around $0 to $200 depending on insurance coverage, and the cost for the drug we will add to our ring costs around $180 for a 2-month supply. So we estimate the cost of our ring will be around a couple $100 a month. The cost of our ring could also potentially be lower because polyurethane is a cheap and widely accessible material.
So taking all of this information, the design and the cost, how are we actually bridging the gap in current treatments that are offered? So with endometriosis specifically, there's not a whole lot of research done with this realm of women's health. However, hydrogel implants are an up-and-coming technology, but are not available on the market. Their goal is to block the opening of the fallopian tubes by swelling inside of the uterus, which is a minimally invasive process, but still has to be done clinically, which is not accessible to all users. In addition, the levonorgestrel IUD is widely available to users. However, it is a very painful process and also comes with side effects such as cramping, excess bleeding, and other side effects. And another form of current treatment is oral contraceptive pills. As we mentioned earlier, danazol is the drug that we are going to be using in this drug-eluting ring, and danazol is also available orally. However, that comes with its own side effects since it is an oral medication which introduces risk to the digestive tract, causing nausea and other side effects in patients. Overall, taking all of this information, our ring proposes a new treatment that works and is sustainable for users with endometriosis. Thank you.